Thanks for watching the EDExplained, experts' advice on treating erectile dysfunction video series. Hi, I'm Dr. Robert Valenzuela. I'm a urologist at Mount Sinai at Washington Heights in New York. I specialize in men's sexual health, including erectile dysfunction. Today, I'm here to talk about the pros and the cons of the different erectile dysfunction treatments. So when we talk about erectile dysfunction treatment, the first thing we always talk about is medication. So medication has been a lifesaver for many men. Prior to 1998, we had no treatment that we could offer our patients as far as oral medications. And these oral medications, we know they work very well. We know they work in approximately 60 to 65% of the men. But there is that subset of population that doesn't work. More than 40% of patients do not respond to oral medications. In addition, you have a subset of patients who cannot take these medications because of comorbidities, such as cardiovascular disease and certain medications that are associated with cardiovascular disease. So it is very important to talk to your physician prior to trying or starting any of these therapies. The side effects associated with oral medications can be chest pain. It can be hypertension. It can also lead to flushing, nasal congestion, back pain. Although these are low risk medications, they do have these side effects. What about other types of medications that are a little bit more invasive? Another form of treatment is an insertable medication. This is a suppository or a gel that can be inserted into the penile urethra. This is usually performed at about 10-15 minutes before sexual activity. It can give you an erection that you'll be ready to have sex and be able to maintain an erection. Now, one of the problems with this type of treatment is it doesn't allow for spontaneity. You need to prepare for that. The medication has to be refrigerated. In addition, one of the things that patients complain of is sometimes they get penile pain from the medication. And with time, the medication just doesn't work very well. So another treatment option is the use of vacuum device, or VED. This is a component or a tube that the penis is inserted into it. It creates a vacuum either manually or electronically, and then you have to put a band at the base of the penis in order to trap the blood inside the penis. Now, in certain situations, that works very well. I mean, if you have the proper relationship, sex is not about one person, it's about two people. And so if they're able to use that and they feel comfortable with it, it's great. And it does work. It doesn't require any medication, no shots, no injections, nothing. So it works very nicely. But like everything else, it's uncomfortable. It loses the spontaneity. You need to take the kit out. You need to prepare. You need to put it on. By that time, you may have lost interest. So it is cumbersome and difficult to use. And along those lines, we also have injection therapy. So that's another type of treatment that we have where men can take an injection, a small needle, inject the medication into the penis. This will allow you to get an erection and maintain an erection sufficient for sexual activity and oftentimes for the amount of time that you require. Now, it works very well. Think of taking a medication instead of taking it orally, you're injecting it directly into the penis. It is very spontaneous in that respect, but keep in mind, having to use this also requires taking the medication out of the refrigerator, injecting it into the penis, and waiting for it to work. That, again, makes it a little bit cumbersome, difficult to use. And one of the things that we're always concerned about is what's called priapism, getting an erection that lasts longer than 4 hours. And that can be a complication that may need to require going to the emergency room to treat it. Another option is the use of penile implant. Now, most people don't think about this, but this is what we call surgical restoration of erectile function. This is where we do a procedure that takes literally less than an hour, and we insert a penile implant. Now, when you think about that, think about a breast implant. When a woman gets a breast implant, there's nothing showing outside. Same thing happens with a penile implant. Everything is inside. It works every time. It's very reliable. It works spontaneously. It can last for as long as you want, have your erection for as long as you want. Penile implant is a long-term solution. Now, like any other surgical procedure, it does have its potential risks and benefits and potential complications. So a penile implant surgery, you can have bleeding, infection, malfunction of the prosthesis. These are real, but the chances are very low. This is a very low risk procedure and patient satisfaction is very high. We've noticed that patient satisfaction can be as high as 98%. And in addition, partner satisfaction is also very high. For more information, visit coloplastmenshealth.com.